During cancer, you may suffer from constipation or diarrhea at different times. This video will provide you a tool on how to assess your bowels and tips to keep them healthy. Understanding what healthy stool looks like helps to explain to the nurse if you have problems. Often during cancer treatment, constipation and diarrhea can be a problem. This may be because of the cancer treatment, stress, pain medication, and changes in diet. There are a few helpful tips to help improve your normal bowel function. This includes light exercise, which helps the movement of food through the bowel, also improves your appetite and reduces stress. You can also monitor your fluid intake by using a water bottle. Is a good way to ensure you get enough fluid each day, about 2 to 3 litres. Key points for staying healthy and avoiding constipation and diarrhea is to engage in light exercise and be sure that you're drinking enough water.
Yeah, so my cancer journey with the diet, because mine was throat cancer and had chemo and radiation, the chemo just, it does funny things to your body, like you feel sick. You know, there's no two ways about it. You feel sick. I didn't throw up through the whole ordeal, which is pretty amazing, I thought. But then food-wise and stuff like that, I was trying to maintain a normal diet, but I was having radiation on the throat, which is just destroying your ability to swallow, produce saliva glands, tolerate certain foods like acidy foods. So the first week, it probably wasn't, the diet didn't change too much, but over the period of the 7 weeks that I had it, by the end, I was just living on a high protein shake that was going into a peg tube straight to my stomach. Yeah, it's amazing how it changes over that period of time, and how do you manage that? Yeah.
And when you got the peg tube, we were trying to be positive because he had that done before the treatment started. We were trying to be positive, going, oh, he's not going to need that. You know, here we are to tolerate the whole period with taking everything like orally. And then, yeah, after a couple of weeks, we realised that that probably wasn't going to happen, and the peg tube was going to come in at some stage during the treatment. So,
yeah, basically saved my life, I'd say, like that tube. And it's amazing how you're looking at these tubes. I had 6 a day, the multidiscipline team. Every time I'd go in there on every second Monday, and it was like going to see the school teacher, and they'd get up to say, hey, you've got to maintain your body weight, and you're going, I'm trying. I can't physically fit enough food. The bowels through the treatment, so I was having chemo once a week. So after the chemo, you're pretty well constipated, and the first week you don't understand what's going on with your body, but there's a pattern. I found a pattern was going on as I got into it. So yeah, I'd sometimes go 3 days without going to the toilet, and then I'd start the little sachets. What were they called again? I forget. Malvacol. I'd start them, and I'd start with one because I didn't want to go from, like when you're sick, if you get constipation, it goes from one extreme to the other very quickly, and I didn't want to go from being constipated to diarrhea, so I'd just ease this in. But I'd definitely try and make sure I was clean, or I'd been to the toilet before I'd go and have my next round of chemo. So that was my goal, and I'd set silly little goals, but they were just so important to keep your health going. And so in a week, I'd probably go to the toilet twice. But, you know what, yeah.
But the whole like separate toilets and everything from the day one, which we probably weren't anticipating either. So, Kirk had his toilet and I had my toilet, and we didn't cross-pollinate in any way. So that was probably something we weren't tracking initially, were we?
No, I mean, we're very fortunate that we had that set up. Not everyone's got that. But yeah, that sort of stuff, having your own toilet, it's just weird.